Hi, everyone. Welcome to AHRMM 20 Plus Conference. Today's Learning Lab session, You're Not Alone, Collaborative Tools to Assist in Sourcing PPE. Hi, everybody. Mike Schiller, Senior Director of Supply Chain for AHRMM, and I'd like you to join me in welcoming our esteemed panelists. We have Karen Conway, the Vice President of Healthcare Value at GHX, Raj Sharma, Co-founder and CEO, Public Spend Forum, and Bill Burke, CEO of HealthEquip. So, Karen, let's set the stage here. Let's talk a little bit about March. Let's go back 6 months, and let's talk about what we began to see collectively in March. We saw a significant drop in production in China. Production of PPE. We saw an equally significant reduction in the exports of PPE, while at the very same time, we saw an increased global demand for that very same product, for PPE category product. This led the FDA to begin to release EUAs, or Emergency Use Authorizations. These EUAs open the door for non-FDA approved product to be used in the healthcare setting. Consequently, this opened the door to the non-traditional manufacturer and suppliers into the healthcare supply chain space. It became a viable alternative sourcing channel for much needed PPE, certainly in those first 3 months, March, April, and May.
It was absolutely a crazy time. Now certainly, what you and I were experiencing, and many of our other colleagues on the presentation today, was nothing like it was happening as if we were back in the hospital working. Certainly in the shared service center, on the floors of the hospital, demonstrating the absolute mission critical nature of the supply chain. I know at GHX we were receiving a number of calls from our providers looking for help in identifying PPE suppliers. We were hearing a lot of calls as well from people saying, hey, you know what, I've got this facility and I could turn it into, I could switch my manufacturing and start doing producing sanitizer, for example. We'd even get calls from people looking for material because they wanted to start sewing masks. I mean, people were really coming together and really trying to help. At the same time, every single hospital, I know you at the AHA and at AHRMM, certainly we at GHX and others, were inundated with calls, emails from folks. I'm going to steal that line from one of our colleagues who said they coined the phrase "I gag." I got a guy. I got a guy who's got something. And the situation was, unfortunately, even though you had lots of these folks who were really trying to help, you also had people who were promising the moon, demanding money up front, and people were receiving at times nothing or inferior product. So, we recognized the fact that there were a number of these unscrupulous vendors out there. We also noticed that people were all trying to vet all of these organizations at the same time, at a time when time was absolutely critical. So that's when you and I started talking about, hey, what can we do to try to consolidate these efforts and help the hospitals and healthcare systems and supply chain professionals who were trying to source these critical products.
And you raised an excellent point, Karen. I think one of the positives that came out of this entire COVID pandemic is across healthcare, everybody joining arm in arm with the mentality that we are all in this together. I really saw walls coming down that had been established for years within healthcare, whether it was membership walls, competitive walls, whatever it was, those disappeared as a result of the pandemic, and everybody came together, which was fantastic. It was incredibly encouraging. To your point, the volume, just the sheer volume of emails, once those EUAs were released and opened the door to those non-traditional suppliers was staggering. Just the number of emails alone that we received at the AHA and at AHRMM that were coming into my inbox, hundreds, and talking with colleagues out there in the healthcare field, they were experiencing the same level of emails from these non-traditional suppliers and manufacturers. And to your point, their main focus was, what's my burn rate? How do I get more product in here for my frontline heroes, the people who were on the front lines caring for the patients? And so to your point, right, that's where you and I began to talk and come together with the idea of how do we create a clearinghouse where we can be that vetting source for these non-traditional suppliers, provide a first level pass, if you will, of these non-traditional suppliers, so that healthcare organizations can take a look at those that we have vetted and have determined were approved and would host, so that they could do further vetting, further review, and follow their own policies and procedures for vendor approval. But at least that first pass was completed. And I think, coming up on this next slide, we'll see just the sheer volume of vendors that were vetted and the pass rate, right? So you look at the significant time savings that resulted as a part of this clearinghouse mentality, this clearinghouse effort, this collaboration between GHX VendorMate and AHRMM.
And it really was, so AHA and AHRMM had really stood up to say, how are we going to help the industry? Obviously, the members, but really the industry as a whole, because at this point, as you said, the walls are coming down. And the one really positive thing about COVID has been this collaboration, whether it's between hospitals that have traditionally competed for market share, or whether it's manufacturers that compete, or whether it's other kinds of organizations providing services. So as you and I were talking back in March, we have a service at GHX called VendorMate, where in normal times we are helping to vet both organizations as well as manufacturer representatives who are going into the hospital, and to try to protect both from, you don't want an unscrupulous person or an unscrupulous company selling to hospitals and healthcare systems. So we had this service set up, and we said, okay, let's do something pro bono together. And as you can see, so the very last week of March, we vetted 112. That jumped, skyrocketed to 376 in the month of April. And as you can see, this has leveled out a bit. It's continuing to happen. I attribute some of this to the fact that we have some other players who are also doing some vendor vetting as well as product vetting, which we'll hear about in a minute. But you can see here that we vetted 886 between the 23rd of March and the end of August. And we're continuing to vet in September, and expect to be doing this for quite some time, along with some of our other partners. And what you can see is only 392, or 44%, even past that initial vetting. And you can see over on the right, I've just characterized some of the factors that we look at in that initial vetting, because that's an important point. We're just trying to kind of let's pare it down a little bit so it's easier for all of the hospitals and healthcare systems. So they're not trying to vet everybody in the world. And then you were able to post this. So you can see we look at things like tax ID and business license. Most importantly, are they on some kind of federal sanction or exclusion list? What's their finances? And then spend a fair amount of time looking online to look at those reviews, any kind of history that would be red flags, eligibility to be doing work with the government, et cetera. But again, it's just a first step. And then we were able to provide that information on a daily basis and continue to do that back to AHRMM and to AHA for you to make this available to the industry.
And, it really was a dynamic period. I mean, this graph really speaks to it. 112 in just a week, and then jumping to 376 for the month of April. And I think one of the things that really we learned as we went along, as some of those unscrupulous players came into the marketplace, some of the very risky terms and conditions, payment terms, shipping costs, all of these variables. So initially, I know when we started to vet the vendors, it was a fairly short list of requirements, as you mentioned here, a tax ID, business license, etc. I think we had 4 or 5 items that we were initially asking these vendors, these non-traditional vendors. But as the volume increased and some of the concerns about product quality, some of these unscrupulous players out there, we began to add additional requirements to the manufacturers to complete. What are your payment terms? Are there additional shipping costs? We wanted to understand any other fees and services that and costs, right, that these manufacturers might be tagging on. What's the estimated delivery time? A lot of this product, right, is coming from outside of the U.S. And so are we looking at a week? Are we looking at a month? What is your minimum order quantity? Some of these manufacturers and suppliers had some extremely high minimum order quantities that hospitals were never going to be able to meet unless they created a coalition among themselves to purchase that volume. So incredibly dynamic. But I think one thing I'd like to just reiterate that you stated was the pro bono effort. I mean, I think what AHRMM and GHX did was indicative of what we were seeing across the healthcare field and really leading by example. We came together and said, let's provide this to the healthcare field. Again, this first level pass so that everybody at least can look at these 300 plus vendors that were approved. So as we received the information back from GHX VendorMate, we created our COVID-19 resource page, and we had all of the vendors that we deemed acceptable to provide low-risk vendors, and we hosted them on our vendor site, on this resource site, and we broke it up in 3 categories. PPE products, we had other products such as testing supplies, lab supplies, etc. And then we had another section for services, and this allowed our not just our members, right? The entire healthcare field, all supply chain professionals to access this webpage. And then look, if you're looking for PPE, great. If you're looking for face masks and test swabs, you click this link. If you're looking for other resources, you click the third link. So we really, as the volume increased, we began to further build out our platform on the COVID-19 resource page to better meet the needs of our members, to better meet the needs of the healthcare supply chain professional. And ultimately, what this began to move to was a much larger collaboration from a healthcare field perspective, as well as a non-healthcare industry perspective. Because as we now know, you've got a number of different industries who have to buy PPE. And they've never had to purchase this in the past, and they have no idea where to begin to look to source masks, to source gloves, to source gowns. And so as word caught on of the work that we were collectively doing between GHX and AHRMM, we began to be in contact with our other organizations. And this really led to a larger effort that the National Governors Association initiated, where they brought together AHRMM, they brought together a number of other organizations, to your point, that were engaged in vetting vendors. I think across all of the players, we probably, from a volume standpoint, I think we're leading the initiative as far as the number of vendors that we were vetting, but we were vetting suppliers, not manufacturers. Some of these other players were vetting manufacturers, which was critically important because they were also providers of this alternative sourcing channels for PPE. But again, what was exciting to see is the effort that we engaged in, other organizations beginning to do the same thing, and then this collective coming together of all of these groups to create a much larger repository, a much larger resource of approved vendors where potentially multiple organizations could have vetted and will have approved that vendor. So now you see that maybe there's 3 or 4 organizations that vetted and approved the vendor, which then increases the confidence level of the individuals looking at those non-traditional suppliers and manufacturers as true alternative sources of PPE.
And if I can just add one comment, the thing that AHRMM started doing was allowing hospitals and healthcare systems to talk about the experience they had. Hey, I tried out the vendor that was identified as low risk, and you know what? It didn't work out. But I tried this vendor that was identified as low risk, and great, good service, did what they said. I got a quality package when it arrived. So it is about this kind of crowdsourcing and bringing together. Because, as you and I had written an article for Supply Chain Brain, it was like sourcing the unknown. You don't do it alone. We've got to do this together.
Right. And that's a great point, Karen, that you bring up. And as a result of this much larger collaborative environment, these vendors there was some negative feedback were immediately taken down from our site, and we shared that with our other collaborative partners, and vice versa. If they had some members that had a negative experience and we also had that vendor, we took them down. So again, just fabulous collaboration and expanding at an industry level. And so I think at this point, what I'd like to do is let's bring in some of our larger collaborative partners here that have come about as a result of this move from our initial effort to the National Governors Association onto this larger repository effort. So what I'd like to do at this point is turn the conversation over to Raj Sharma to talk a little bit about the GovShop platform. Raj, I'll move the slide, and it's all yours.
Great. Hey, thank you, Mike. Thank you, Karen. Great to be here. First of all, I just want to commend everyone's efforts. As we've heard all along, this is such a massive undertaking, and really everyone's stepping in. That's what we've seen. And, as we talk through this, I think we've seen that where there was on the buyer side a little bit of protectiveness, if they knew sources, they realized a little bit later on that they also needed to work together. Mike, I'll just start off by just telling people a bit about, our effort. So GovShop is a broader supplier intelligence platform for government as well as related sectors to find anything, find suppliers. And so as part of that work, we have 1.9 million companies. We were brought in early on. I remember getting a call about, as the joint task force for the Department of Defense and the government was being stood up, getting a call late February from the U.S. Army, and in kind of a panic mode saying, hey, we need to figure out where all the PPE suppliers are. So it sounds familiar. And so we got to working, and pretty soon thereafter, as you could see on this slide, we were then working across the Joint Task Force, really trying to help them not just understand PPE, but ventilators and the entire supply chain. And then soon thereafter, as you mentioned, got engaged with NGA, and that's how we met and started working together here. But over time, what we were able to do is, because of the scope of what we were looking at is a bit broader than just PPE, we were asked to really dive into a number of categories. And there's a slide that comes up next that speaks to some of those. But we ended up actually, because it's an open platform, GovShop is, any supplier can register. A lot of new companies coming in, as you mentioned, over 8,000 companies coming in and into GovShop. So we had roughly about 4,500 or to 5,000 of those already, but roughly about 3,000 more companies. And you can imagine, as Karen mentioned, what a massive undertaking to say, okay, how do you really distinguish from the suppliers that actually are legitimate to every broker that is, or consultant that's popping into the market as an expert now. So that was a challenge similar to the ones that we all faced. And so we also put a vetting process together. And as part of that, we actually went through over 1,000 suppliers, and we roughly, this slide actually says including 1,000 plus verified, but it should say we went through 1,000 plus verified companies and roughly verified about 500 plus companies. And that's because we're looking at a broader set of categories. So our numbers, Karen, might be similar and overlap a little bit. We also started documenting what products these companies are providing. So that was one of the other key things that people were looking for is, really understanding, are these certified products? What manufacturers are they coming from? What's the source? Is it domestic? Is it China? Where are they coming from? So we started documenting that, and that's all part of the GovShop platform. And then the other thing that comes up a lot of times is contracts. People wanted to know, because of the urgency, how fast can we go contract? Luckily, there's emergency procedures in place from a procurement standpoint, so many could go out, and especially government contracting, as you can imagine, is complex sometimes, and sometimes some of the hospital systems, et cetera, also have to comply with some of those rules, depending on if they're working with VA, et cetera. But we documented a lot of the contracts that were already in place. And then the other thing, I think, Mike, you and I have talked about a bit, is we've been working on a project, and not as urgent anymore, but still something of potential value, is price benchmarking, because there's so much, really not enough transparency in the market in terms of understanding where all the price is going for different types, whether you're talking about N95 masks or you're talking about gloves, et cetera. But, going through that exercise and providing that visibility so we could give at least the buyers some level of confidence that, one, they're getting vetted companies, but two, the big question of, what should I be paying for this? Am I negotiating? And with a lot of new buyers coming into the market, they really were struggling with that. So we decided to take that on as well. Let me just go to this next slide, just to give you a sense of the types of things that we saw people buying, and the Joint Task Force asked us to look at. And they're probably similar, I think, across the board. There are a couple of unique ones. We dove into especially the testing area, and spent a lot of times not just looking at, what testing kits are there, but the efficacy of them. Because again, what's the quality? What should we be selecting? That was one of the questions that kept coming back. Ventilators, of course, not as big an issue as it was early on. PPE, a lot of the cleaning and disinfectant products, not just the sanitizing wipes and the liquids, but the barriers and the disinfecting machines and technology that's out there now. Which has become a big deal, especially as companies open up, hospital systems are looking for this. We've uncovered a lot of technology out there that's starting to come to the market. And then a lot of things like setting up, extra hospital beds, unfortunately, was a need. So those are the types of things we covered. And in last part I'll just mention is the vetting process. I haven't, some of the same criteria, Karen, as you mentioned, but I just noted some key issues early on that we encountered, right? And I think all of us encountered. Many new companies, right? That was the tough part about verifying. There's many new companies, especially middlemen, coming into the market, and with no track record, and everybody committing to and saying that they could actually deliver product on time, and that caused a number of issues early on. So that issue has luckily been managed, but that's one of the things that we paid a lot of attention to, is what's the experience, just like others, what's the experience, history, do they actually know the manufacturing base, how well do they know the products? So those were a couple of other things. And then one last point I'll just note is the limited financial capacity. I think that's one thing that's come up a lot, and I think we can probably attest to, is a lot of the new players coming in, because they don't have any financial capacity and they're asking for money to be paid up front, et cetera. They didn't have e-commerce capability to actually, for a lot of smaller buyers, to be able to order. So that created complexity. So the minimum order quantities are quite large. And then the second piece was the not being able to have product on hand. So that created a lot of long lead times, and it's still an issue. So we've been looking at suppliers that actually have the wherewithal to actually bring product And we've now established or looking at establishing an e-commerce capability and logistics. We're working with a logistics firm now where they can actually pick, pack, and ship the product for smaller orders, because the smaller orders, there's still a struggle out there that what we're seeing is a lot of the smaller buyers still have really limited capacity or limited places to go. So I'll stop there and see if you have any questions.
So Raj, thanks for that. That was excellent coverage of the scope of your program, and really have enjoyed working together with you as we continue to build out this larger repository and in a full effort of collaboration. You know, one of the things I'd like to just bring up, you know, you talked about the UV, the cleaning space, the disinfecting space, and not from a disinfecting wipe, but more from a equipment perspective. So very interesting story, just to speak, I think, to the scope of the need out there that goes beyond healthcare. We actually had a professor who reached out to us. He was looking for UV equipment that could be used to potentially clean the musical instruments for the orchestra at the college or at the university where he worked. So again, just a fabulous example of, you know, this expands well beyond healthcare. Right, this goes to a number of non-healthcare industry fields that have this need for these various PPE disinfectant type of products.
Yeah, no, there's so much. I think one interesting thing that we've seen lately is, especially in that area, a lot of new technology coming to bear. And so we just discovered one company out of the UK, as another example, Mike, that brought their product, and the UK Health Ministry just actually signed a large contract with them to supply to their hospitals. So, and it's basically to really speed up the whole process of disinfecting and cleaning the air, and so there's a lot of that type of technology, but there's a huge demand. And even in that space, what we saw when we asked them what's their capacity to manufacture and what's the lead time, it's several months out. So you have to be one of the first buyers out there to get it, because there's very limited capacity.
Well, and if you think about it in the context of hospitals here in the U.S. stopped procedures through the months of March, April, and into a part of May. And as they began to ramp up or move back into performing elective procedures, I think there was an increased need for some of these room cleaning type of equipment, these UV lights and other types of equipment to provide an increased level, or I don't want to say an increased level, because the cleanliness is always at the top of the list. But I think there was just a greater need for this than perhaps prior to COVID. And so again, just it's not just during the peak of COVID in March and April. It's moving back into I don't know that you can say a post-COVID environment. I don't know that we're there, but certainly a slowing period right now.
I think the challenge there also is, where there was a huge demand for, say, and not a full understanding of ventilators, for instance, the supply, right, and what's needed and where it exists, and N95 masks. Now, what we're seeing in the whole disinfectant area is, because now you have the broad swath of the economy, everybody needs that, whether it's school systems or not just hospital systems, right? School systems, commercial companies that are opening up. So there's a much bigger demand and very little supply in that area. So that'll be interesting. We'll actually be publishing more of a technology handbook, and that we've kind of been preparing of what's the technology that we're seeing out there, and what are the types of companies providing it.
Yeah, that's an excellent point. As we move forward, you now have a number of other players that are going after an already scarce number of resources, but we haven't increased the level of product availability, but we've certainly increased the number of players who need that product.
Yeah, no,
Well,
it's going to be, I think the whole demand supply imbalance, I think this will make for if I was a professor, I think interesting, study in economics and demand supply chain and demand and supply, and looking at how, quickly things can change from one market to another. So there's I've studied economics for a long time, and I think there's a lot of, and you've seen a lot of players take advantage of the, let's say, asymmetrical information and market arbitrage opportunities out there. So there's a lot of people that have made a lot of money from basically this imbalance that exists and the lack of transparency. So I think as we look ahead how to prepare, I think that's something that we should all think about. And we are working with North Carolina State University, a number of other academics as well, to think about, how do you prepare, because this market arbitrage and this lack of information cause bigger problems, and they can be managed better as we proceed.
Absolutely. Raj, thanks so much for again, sharing with us the scope of GovShop. At this point, Bill, I'm going to advance the slide, and I'd like to turn the presentation over to you. So the floor is all yours.
Very good. Thank you, Mike and Raj and Karen, for having me join today. It's a pleasure to be here and be talking together, since we've been working together so closely during these last few months. So next, let me take you into the HealthEquip marketplace and just share a little bit more information about the Verified By program, as well as the user experience that I described. So as a buyer, I can come into HealthEquip marketplace in an anonymous path and wait to sign in and register until I'm sure I'm happy with what I found. I can also then go all the way through on the platform and either procure what I found by credit card, or I can procure that using a PO method and procure that with milestone and progress payments, or what we call on account. And all that is handled digitally from the seller's perspective and the buyer's perspective with the marketplace. And so what you'll see here is a very easy ability to come in and search. In this case, it's just showing some of the items and suppliers that have been verified by, and I'll take this hand sanitizer by the Vertical Collective. While this fairly new seller to the marketplace has been vetted by AHRMM and GHX, we have completed also the FDA verified by step for this hand sanitizer by going all the way to the FDA source data with the documentation that this seller has provided. For their nitrile gloves, we're in the process, so that icon is not showing up yet. We're also in the process of gathering, will they be able to provide chain of custody information? Will they be willing to provide a sample in advance for particularly large orders? And so we're making it easy for the buyers to visually see, how am I selecting items from sellers, and how can I digitally handle compliance? I can also go on for that hand sanitizer. I can click and download that actual FDA letter, that certified by letter, or that EUA letter, whatever it is that they have as compliance documentation. I can make that part of my digital process. Next, I want to just show a little bit about the experience that the seller is going to have. And in our marketplace, we have both manufacturers and suppliers as sellers. But what we are providing is the ability to create an online storefront. And in this case, this particular seller is one of my favorite mid to market. It is actually founded by two doctors that are active right now as doctors, but they saw the tremendous need, and they organized to use their sort of learning and consulting based company to move in as a novel supplier for PPE. And in this case, one of the doctors is demonstrating by video sort of an unboxing of 3M N95 masks. He'll be able to show the serial number, talk about the product, talk about the source of the product and what they're able to provide, and do that all digitally so that the seller can gain confidence and keep working to reduce risk as the buyer goes. The buyer can gain confidence as they go through their procurement process. And next, I want to share a bit more about the portal that they're able to have and show that as a buyer, I can now go to Med to Market's portal. Not only can I see their other items, but I can see feedback. What are their reviews? Are they 5-star reviews? Are they 4-star reviews? I can see actual written reviews. I can understand more about any specific policies that they have. I also have access to all of the compliance information. So any of that documentation, they're able to share and post that. If they have additional product information, they're able to share and post that digitally so that I, as a buyer, can move through that traditionally manual email back and forth, weeks of work and time, and move straight into having that information digitally. I can also, as a buyer, message them through the platform, work out any specific terms, and in the process of going through procurement, add a PO. If that's the way I'm going to buy it, I could buy it with credit card if it's a smaller amount, and then digitally follow that product delivery as well as financial progress payment through the process. So that's a bit of what I wanted to share at the next level down of what these exchange platforms are moving towards. This is certainly HealthEquip. But I also want to wrap up on sharing 2 stories that sort of drive the point home. One is of a seller that we had that was just in every way looking like a top seller. They were vetted by AHRMM and GHX. They acted very responsibly and timely with us in terms of building their storefront, getting their items on. Their item mix looked fantastic. Their descriptions, everything, documentation was put up on the site. And we felt in all ways that this would be one of our better sellers on HealthEquip Marketplace. But unfortunately, during an order for a KN95 mask that was listed as FDA 510 cleared by status, they shipped another mask, and they shipped a mask. And furthermore, that mask that they substituted was one of the KN95 masks that CDC NIOSH had performed testing on in May and listed as having failed testing. In fact, of the 30 masks tested, all failed. Some of them were only 43% efficient. This was counterfeit product. And so this is an example of where, because of our verified by program that verifies that the item, not just the seller, but the item level across all of these, measures that we have, we were able to trap and capture that. Fortunately, the buyer was not out any money. We caught the counterfeit product. Of course, we immediately removed that seller from our marketplace. But moreover, back to this crowdsourcing idea that Karen is fond of saying, we were able to share that information back with AHRMM so that they could update their list. We expect then that other participants, such as Raj and such as other actors in the marketplace, can see that and also make sure that they're not promoting that bad actor seller. And so that is, I think, the value of us as actors and participants in the marketplace, sharing data and working together. And then I'll end on another story, which is a company that came to us through the AHA and through a relationship with A.T. Kearney named Clark, and they have funds to donate as part of their own, philanthropic endeavors. And they needed a way to move through the sort of risk that exists and find a supplier that would achieve their objective, which is to enable PPE to go to hospitals that are treating COVID-19 patients. And for us, we were able to use both aspects of our HealthEquip platform, the donor exchange platform, as well as marketplace, to intake those funds through our 501c3, to use those funds to actually procure supply, to use the data of demand data to understand that during this time, what hospitals are telling us they need most through their demand requests, because we're gaining demand requests based on needs criteria, as I mentioned earlier, but also specific quantities and items, are nitrile gloves. And this has happened over the past few weeks when, as everybody knows, nitrile gloves are in a tremendously short supply. We were able to identify one of our sellers that have been cleared by AHRMM and GHX and cleared by verified by at the item level, that was able to source those nitrile gloves, provide chain of custody documentation, provide certification documentation, and bring those through HealthEquip, and then through our ethical matching distribution process, move those gloves out into the hands of those that needed those most, and provide that all in a safe way for Clark as a donor. And so that's a very positive example of how we see using this digital platform to make good outcomes happen and to de-risk it. So on that, I'm going to sort of wrap up, and Mike, stop and see if you have any questions that I can answer. Thank you.
Bill, thanks so much for that great overview of your program, the scope of what HealthEquip is doing. Just a couple of quick points I want to touch on that you brought up. The sample and the testing, that's a huge component of these programs moving forward. Data, the need for data. I think nothing has become more clear during the course of this pandemic than the need for better, more robust data. Karen, I think you're going to touch on that as we move into our wrap up here in just a second. But the key theme here, clearly, if you haven't picked up on it already, is this much larger collaborative effort between a number of organizations and potentially competitive organizations. And so today we've got HealthEquip, we've got GovShop on this presentation, but I do want to give a little bit of airtime to some of the other partners that we have worked with very extensively throughout the course of the pandemic. Starting in March, we've worked with ECRI, very, very closely with ECRI. Project N95 is another organization that we worked with. We've already talked about the National Governors Association, or NGA. Healthcare Ready, Stop COVID-19 Special Operations Group. We've also worked very closely with other associations, such as Strategic Marketplace Initiative, or SMI, and ISM, the Institute for Supply Management. So this just small of healthcare industry. Take this, Karen, if we can move into a wrap up here. Positioned moving into fall and winter months than we were when we first came into this pandemic. There's a number of programs in place, infrastructure that is in place, collaborative efforts that we've talked about that are in place, with Dynamic Ventilator Reserve Program, vendor vetting repository, and these different resources that our healthcare supply chain professionals and non-healthcare industry partners have access to. So I think, our theme here is you're not alone. You're really not alone. And the whole point of this presentation is to really point people to the resources that are available. If a resurgence of COVID-19 takes place to the levels that have been discussed, we're going to find ourselves back in a March, April type of month. But again, I think the fact that we've got a lot of programs, a lot of infrastructure, a shared economy, which is a concept that has come out of this entire COVID pandemic, all in place, and resources that are available. Karen, what closing thoughts do you have to share?
Well, I think, just listening to you, Mike, and to Raj and to Bill, and there's certainly many other players, as my colleagues have brought out. It's not just us here, but it really is so many people coming together. And I think, data is better when shared. So we're all gathering data, and when we can share it with one another. One of the things that we've discovered, it's not just PPE, it's not just the ventilators, it's not just the sanitizing wipes, it's the technology, it's lead times, it's shipping, it's the product vetting. All of these things have been this group. We've all been in the COVID classroom. And what I would hope, because the fact is, one of the very first presentations I heard after the COVID crisis began was from former HHS Secretary, Governor Mike Leavitt, who talked about the fact that pandemics generally last a couple of years. But as we have seen, you have these hotspots, you have these surges. Now we have other organizations that are in need of critical supplies, et cetera. I love the concept of an algorithm to try to identify where the greatest need is. So we've got a start of something very good, but the more that get involved, the more we can share information, the more we can direct people, help people kind of follow those leads on supplies they need, that are safer, and be able to get some of the organizations, the individuals, the products that are not good, get them out of the supply chain so we can continue to work together. I would just simply encourage, let's just keep talking. Let's just keep sharing information. Let's leverage some of these great tools and platforms that have been built. I'm very, very proud to be a part of this effort.
And I think look forward not only to just what we've discussed, PPE, equipment, disinfectant, supplies. We need to start thinking about vaccination programs and the supplies that are needed for a vaccination program, not only COVID-19, but flu vaccinations, and the availability of syringes, availability of freezers, and the products that support vaccination programs. And so, again, Karen, to your point, it's the conversations that need to continue. We need to ensure we've got all of the stakeholders around the table, and we need to engage in these continued collaborative efforts. And again, it comes down to data. I love what you said. Data is more meaningful when it is shared. So any other closing thoughts from our panelists here? Well, I want to thank everybody for your time today, and I'd like to open it up to our audience for any Q&A. I'm sorry, was that you, Raj?
No, I was just going to say thank you so much, and thank you for, I think this has been, as Karen mentioned, an amazing initiative, and just showing the power of, when people come together in organizations and all this, how it comes together, what can be done. So thank you.
Well said. Bill? Bill, any closing thoughts?
Same. Hi. Fantastic. Just really look forward to continuing to collaborate. And as we work together to solve this macro problem, I think there are interesting models that are coming out for future medical procurement for all categories. We're honored to be part of that future process with HealthEquip, and certainly look forward to continuing to work together. So thanks.
Again, I want to thank each of our panelists. I want to thank each of our panelists, Karen Conway, Vice President, Healthcare Value, GHX, Raj Sharma, co-founder, CEO, Public Spend Forum, and Bill Burke, CEO of HealthEquip. And at this point, I'd like to open it up to any questions that the audience may have, and want to thank you for attending this session. We hope that you're going to walk away with a really strong sense of the collaboration that is taking place across the healthcare field and the resources that are available to you as we move into fall and winter months. So again, thank you for your time today. We so appreciate you sharing some of your time with us. Bye, everybody. So not really goodbye, but let's.
We're back.
The magic of virtual conferences. So now is our Q&A time, and I invite the audience to go ahead, type in your questions. We do have some questions that we'll go ahead and tee up and answer, but if there are other questions from the audience, please feel free to type those into the questions and answers section right next to the chat box. So Jimmy Chung starts out with a good question. How are we preparing for supply allocations for vaccines? And I apologize. I tried a couple of times to answer the question in the Q&A box, Jimmy, but wasn't really successful. And going to skip over, but we'll make sure that it gets out to all of the attendees in the audience. Basically, the Department of Health and Human Services plans to include ancillary supplies such as needles, syringes, alcohol prep pads, and certain personal protective equipment with COVID vaccine shipments. Again, there's a lot of details on what the kits will contain that I will not cover, but the ancillary kits will contain enough supplies to administer 100 doses of a COVID-19 vaccine, and each kit will be automatically ordered in amounts to match vaccine orders. So again, as far as the quantities, we'll go ahead and share that with the audience afterwards. We'll make sure that that gets out to everybody. But that's the information that I have. Karen, Bill, any other information that you might have that you can add to this?
You know, a couple of comments. One is that it's important to think about the cold chain for these supplies, for the vaccines, because, and also several of the ones being tested require 2 doses, and they need to be kept at extremely low temperatures. I know that folks like FedEx and UPS have invested in this deep refrigeration, but we need to be thinking about that. Jimmy also asked the question in terms of allocation, and there's an interesting op-ed piece that a friend of mine wrote the other day. Devendra Mishra is with the Biosupply Management Alliance, so we're working with a lot of the bioscience companies, and he talked about the need for international collaboration because a lot of countries, including the US, are already entering into agreements in terms of how much they will buy, and they're already doing that now, but I think it's important for us to look at this from an international perspective. I'm more than happy to share that link, and I'll try to find it and put it in the chat, or folks can reach out to me. But Bill may have some other thoughts.
Yeah, I mean, I could just share that we're in discussions with some of the states. The states are problem solving really hard right now to try to figure out there's the registry part of it. So there's a vaccine immunization registry for all people, and segmented by priority groups. And then there's the actual physical logistical supply chain aspect of the vaccine that I know. Just HealthEquip came out of Merit, which is a consulting company and a dev app company that's closer to Microsoft. So we're actually in some of those discussions through the other company I'm the CEO of. And I can just tell you that the states are really problem solving very hard right now to try to figure out how they're going to handle the logistical movement of vaccines, maintaining all of the, the stringent lot genealogy track trace and movement of the product. And I'm encouraged by what I'm seeing. So I think it's going to get solved. But that's, I guess that's a perspective I can share that will help enable success.
Well, thanks, Karen. We've got another question here from, from Dr. Janet Bruno. Do you see a broader vision for a technology-based solution for smoother post-pandemic healthcare supply chain functioning? I'm just going to start out really quickly and just talk about some of the shared economy platforms that are out there. AHA has the Dynamic Ventilator Reserve. Resolink also has a similar platform. And I really see these platforms taking hold and becoming maybe a mainstay, or at least to augment the movement of supplies from low-use areas to high-use areas. Could even include staffing. Karen, Bill, your thoughts on these platforms? Or technology-based solutions for smoother post-pandemic supply chain. Sorry,
Karen. Go ahead, Karen.
I suspect Bill and I both have a bit of a bias with two platforms. I think, there's going to be a tremendous need to share data, et cetera.
Yeah, I agree with that. Yeah, I think really there's a lot of pressure on domestic supply. There's a lot of pressure on living up to sort of diversity programs for supply. And there's a lot of pressure on layers and buffer stock and performance against potential spikes, obviously. So I really do see this as a time of high innovation for hospitals and healthcare supply. And I think it will be very exciting. I think that the time is right with the cloud enabling technologies and data lakes and what can be done against data in terms of algorithmic learning. I think it's going to be a really exciting time. And I think that these issues will get solved. And I think moving to digital and using data, not just inside the four walls of a hospital, but at an industry level, at a collaborating level, and upstream in supply chain, not just the supplier or manufacturer. But it was a great question AHRMM had about, is anybody doing vetting against raw material sourcing? So I think data is going to be the enabler to get at problem solving, and it's going to be an exciting time.
Yeah, I agree. Data, I think, is one of the areas.
I think the one thing we need to.
Sorry, go ahead, Karen.
Sorry, no, I think I'm having a delay, so I apologize. I'm going to let you talk.
No, go ahead. Go ahead, Karen, please.
Okay, maybe I don't know if I've got a delay. I don't know if I've got a delay or not. I apologize. So hopefully, I'm not sure how this is coming out. But I think we need to remember, yes, you need the technology platform. You need the willingness to share, but let's not forget the importance of speaking the same language, the importance of calling the same thing, the importance of things like the unique device identifier, actual device identifier, things like global trade item numbers, et cetera. Going to be critical.
Very critical, Karen. The shared platforms, the technology to enable a smoother supply chain, whether it's during pandemic or just in general, adoption of data standards is key. That is absolutely a key element there. Another question that we have around Project N95. What do you think of Project N95, excuse me, for buyers who have smaller purchase needs? So I know Project N95 has done a lot of work around aggregating or creating aggregation buying opportunities where a number of hospitals can come together and put their orders, compile them to create a much larger order, gain economies of scale, reduced price, and some of the other advantages that come from that aggregated buying model. So I think it's another platform that's out there and that's available to not only the healthcare field, but also to other industries. So hopefully at the end of this session, you'll get a sense that moving into the fall and winter months, at least in my perspective, I think we're better positioned moving into these fall winter month periods with the potential for high flu vaccine or high flu and COVID resurgence, but we've got the infrastructure in place with some of these models. And I think the two that we're highlighting today, the other players that we've discussed in Project N95, all give us the ability to look at those alternative sourcing channels. Bill, any thoughts? It looks like we may have lost Karen. So, Bill, any thoughts that you have regarding just platforms in general as we move into the fall, winter months?
Yeah, I think so. What we're seeing with HealthEquip is a similar kind of a situation with the marketplace where people that have smaller minimum order quantities can come in and find verified, vetted, FDA sort of vetted at the item level. And that's a bit of the supply need that maybe is not addressed with traditional supply channels. And yeah, that reverse group kind of bid approach is something that we're enabling as well, so that those smaller buyers can aggregate and get to a place of price and also terms, because a lot of these smaller orders, these manufacturers, they want to have payment up front. They want to have we want to be able to have a little bit more weight against delivery time and sort of price with that approach. So yeah, I think Mike, you're right. We're in a better place than we were certainly when we were all running into the fire back in March, April, sort of building and developing these platforms and not sleeping and, doing all these things that had to get done. I think there's a stability that's happening. And I think we're going to be in a much better place if we start to see some of these demand streams come online. Yeah.
Yeah. Well, we are a minute past. So, Bill, I want to thank you. I want to thank my colleague, Karen Conway, as well, and Raj. Really appreciate the perspectives and certainly the partnership that we've engaged in over the last 6-7 months. I think, again, it's really positioned the healthcare field and industry in general and put us in a better position coming into fall and winter months. So please be sure to take the survey at the conclusion of this session. We thank everybody for carving out some of your very valuable time to spend with us. We hope that you gained some valuable takeaways from this, and we'll also have some other questions that were not answered. We'll go ahead and get some answers to those questions as well. So once again, on behalf of my esteemed colleagues, I want to thank you for your time today. Have a great day, everybody. Bye-bye.